Let me tell you about this story. THANDEKILE'S SIBANDA has lost the ability to speak since a stroke in September. Disoriented, she no longer leaves the confine of her room. Frequent power cuts means she's for the most part in the dark with her daughter ZITHEMBISO. ZITHEMBISO asks her, "Do you remember this man?" pointing at THANDEKILE'S husband, and this lady pointing at an old picture of THANDEKILE. Before her stroke, THANDEKILE took a nursing aid course thinking she could help sick patients. Now she's the one who needs help. Doctors across Zimbabwe have been on strike since September, so the only care she can get is from her daughter.
Do you think sometimes she gets frustrated?
Yeah, she does.
You get frustrated?
Because at times we might be looking for something and she would have seen it.
THANDEKILE can hear and understand our conversation. When she collapsed during her stroke, her family rushed her to one of the few functioning hospitals in the country. Most medical staff were on strike, and it took 3 days before a doctor could see her. Her condition worsened because of insufficient care, her right arm paralyzed. The doctors' union say the medical system is to blame.
Things like gloves are in shortage, things like syringes, things like needles, things like cannulas, IV fluids, the most basic things that you're supposed to find in the hospitals. They are not there.
A hospital director gave Al Jazeera rare access to one of Zimbabwe's public hospitals in Bulawayo. In the wards he chose to show us, there was no shortage of equipment, but few medical supplies.
Right now the government is backing its major problem is this, the sanctions and their inability to get foreign currency to import drugs. So that's beyond my control. But I cannot sit here and wait. I have to work and use whatever resources is available to save lives.
Most doctors on the wards refuse to talk to us or be filmed. A curtain of shame shrouds conditions inside hospitals. With doctors paid less than $70 a month, not only are they protesting over pay and working conditions, they say the government is failing to protect the sick. But when they took to the streets last September, they were met by riot police.
The government's response was to fire about 400 doctors in a country that's already short of medical staff. And while some have returned to work, it's the patients and those that are sick that are paying for this crisis.
Private care is unaffordable to most. Zimbabwe Cares is an online citizens movement that raises funds to help those desperately in need of treatment. But it can only do so much. Abandoned by a broken health system, many people in Zimbabwe are left to cope however they can, or left to suffer alone. Nicolas, Haque, Al Jazeera, Bulawayo, Zimbabwe.